Hey guys, so in this video I wanted to respond to a post that I saw. This was actually on Reddit and it's in the um, medical assistant forum, however you want to say that. But I definitely feel like it's important to address, and I think that it's important to talk about because a lot of people are choosing to do online medical assistant training programs right now. And this kind of has to do with that. So let me read what the person said and then I'm going to share my thoughts on it. So this person says, I know this is a very dumb question, but I did an online program and I'm recently at my new externship. Just to make sure, do I have to wear gloves to label blood and urine tubes as well? I'm getting different answers. First of all, I'm not sure why this person would be getting different answers, but secondly, okay, this should be common sense. Although I have seen people that I work with currently grab a urine specimen cup without wearing gloves to put the label on it. Definitely don't do that. You don't know what this person has in their urine. You don't know what this person has going on in their body fluid. There is such a thing as universal precautions, and I feel like any and every medical assistant training program should have discussed, at least in a short form, should have discussed about universal precautions, like standard precautions. It is just something that I feel like should be common sense, but obviously it's not. As someone who does laboratory sample collections as part of my normal job, not just at the main clinic. At the main clinic, I do like urine samples, or I help with pap smears as far as labeling the specimen cups. I help with wet mounts and culture swabs and throat swabs and wound swabs and nasal swabs and all of that stuff. Never, never, never. I don't understand why this is a question because, like I said, you don't know what this person has in their body. You don't know what this person has in their bodily fluids. You don't know what is going on with this person. So why would you want your skin to come in contact with that if you can avoid it? Gloves are there as a way to protect you. And when you are collecting a specimen, blood or otherwise, it is vital for you to wear your gloves, not only as a means to protect yourself, but also as a means to protect your patient from germs that may be potentially on your skin. Obviously, you should be doing proper hand hygiene and things like that, but some people don't. So I just feel like it's important to reiterate the fact that, one, you should be doing proper hand hygiene before coming into contact with a patient during some sort of specimen collection, regardless of what type it is. But you should also be wearing gloves. So I have never not worn gloves for any respiratory viral panels, any throat swabs, any nasopharyngeal swabs, any sort of swabbing. I am wearing gloves. Drawing blood, I'm wearing gloves. Urine specimen cups, I'm wearing gloves. I don't understand why you wouldn't want to wear gloves. But like I said, I don't know if this person didn't receive like the proper education on standard precautions and things like that, or bloodborne pathogens, or whatever the case may be, but this is something that I feel like every training program should be teaching you. Even if you are just putting the label onto the specimen cup. So let's say we'll use this salt shaker as an example. Let's say this is a specimen cup and you're gonna put a label on it, right? So we'll use this receipt as the label. If you're going to put, say it's sitting on the counter, you could touch it, but to put it on there, you could accidentally touch the other side. You could come into contact with whatever, even like a urine specimen cup especially, even if the person has wiped the urine off or whatever, there's still a chance that there's something on the outside of the cup. Just don't take the chance. Please use your common sense and protect yourself. Don't put yourself in harm's way or at risk because you don't want to put gloves on. It's so simple to put gloves on and then take gloves off and wash your hands. Like, I worry about the future of healthcare and just like people's health when people are asking questions like that. And please don't take this in an offensive way. I know that none of you guys, or at least I hope, this wasn't even aimed at me, this question, but like I said, I feel like it is important to address. Definitely wear gloves, because like I said, even if you're just labeling the tube of blood, there could be blood on it. If you have never drawn blood before, I will tell you, I just did labs on a bunch of people on Friday. Today is Sunday. I just did labs on a bunch of people, and even the specimen tubes, like from the venipuncture, the inside of the tube lid had blood in it. So that is something to definitely consider as well. Just because, you know, the blood is in a tube doesn't mean that blood doesn't get elsewhere. Depending on what type of specimen handling or specimen processing you have to do. I know not every clinic or not every practice has their MAs draw blood. Obviously, when I'm working at the main clinic, I don't have to draw blood, but when I'm at any of our satellite clinics, if somebody needs a blood draw, I have to do that. So I feel like your program definitely should be teaching you these things, but at the same time, if you have a question like this, never be afraid to ask somebody. Like if you're at an externship site or a clinical site or even just at work and you're questioning whether something that you're doing is what you should be doing, ask somebody who's been there, ask your supervisor, ask the provider that you're working for. You know, somebody will be able to point you in the right direction. And if you are being told to do something that you're not necessarily comfortable with, or you're not sure if that's how it's supposed to be done, look it up, do some research, ask someone else just to make sure. Reach out to your instructor, because you, like this person says that they are in their externship. So you should still have at least some sort of communication during your externship with people at the school that you are getting your training from, if that makes sense. So anyways, I hope that this was helpful. Definitely always use PPE if you are coming into or potentially coming into contact with anyone's bodily fluids. Not only that, but I will say, like when you are getting ready to draw somebody's blood, there are different things on the surface of your skin where if you were to touch the patient, so let's say you're about to draw blood and you wiped with an alcohol swab or whatever before where you're going to do the venipuncture at, and then you touch with your hand, you could have just transferred germs or, you know, whatever that was on your finger to this person's skin. If you don't go and swab again, what did you just do? Think about that. Not only that, but let's say you had an open wound on your finger and you're not wearing gloves, and this person had some sort of disease that can be passed through open wounds, and you go and touch that specimen cup and it doesn't look like there's anything on the specimen cup, but by touching it, you've then transferred whatever is on that specimen cup that you maybe can't see. It's now in that wound. So again, think about what you just did. Things to keep in mind. If you guys have any other questions or would like me to discuss any topics on my channel in the future, please be sure to let me know. I would be glad to make a video about it, talk some more about it, answer any questions that you may have if I'm able to. If I'm not able to answer your questions, and I've said this before, if there's a question that you guys have that I'm not really able to answer for you, I will definitely try to point you in the right direction. So just be aware of that as well. So with that being said, I will talk to you guys in my next video.